Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, tuning into our online affiliates around the world, including our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. Among other things, November is recognized as National Epilepsy Awareness Month. And one form of epilepsy that we're going to be talking about today is called Dravet syndrome. We're going to talk about not only, of course, the significance of it, but also treatment options that are available. Here to help us with that today, we're excited to welcome neurologist Dr. Mary Z to our program, as well as April Fontaine, who is a parent of a child with Dravet syndrome. We're going to talk to them not only about what the experience is like for a child dealing with Dravet syndrome, but also the treatment options that are available as well. Thanks for the two of you for the time. Really appreciate it.
You're welcome.
Good morning.
Dr. Z, I want to start with you, if you don't mind. For our audience, of course, they may be familiar with hearing about epilepsy or someone who's epileptic, but they may not be as familiar with Dravet syndrome. So why don't you let them know first, what is Dravet syndrome?
Well, Dravet syndrome is a rare form of epilepsy where the seizures are very difficult to treat. It begins in infancy, often associated with seizures that are prolonged, lasting greater than 15, 20 minutes, and focal, and associated with illness and fever, at least initially. There is no cure for Dravet syndrome, so this is a lifelong condition. Many children with Dravet syndrome also, in addition to having prolonged and frequent seizures, have behavioral issues, developmental delays, including autism, movement and balance difficulties, growth and nutrition challenges, sleep difficulties, delayed language and speech.
Well, I tell you, and that gives our audience a good foundation here for this conversation. April, I want to bring you into the conversation, and thank you so much for sharing your story. When was your child initially diagnosed with Dravet syndrome?
Sure. So my daughter's name is Julia. She's 10. She had her first seizure at 2 months old. She was very young. We were lucky in that we got in with a pediatric neurologist who had heard of Dravet syndrome, and so she was actually diagnosed at about 8 months old. But between the months of really in the first 2 years of her life, she spent a lot of time in the emergency room because of very long seizures.
Wow. So when it comes to Julie then, April, I mean, what has it been like for your family in getting your child treatment and also other resources that may be needed?
Sure. So it certainly has been a journey. She's 10, and so cognitively she's about 3. She is diagnosed with autism as well, so we see a lot of behavior challenges with her. Certainly her language is her biggest deficit, so getting her to communicate with us is often difficult. So, but, we've had an amazing support system around us. She has a full-time nurse that goes with her to school one-on-one every single day. She needs that for her seizures because we've found that seizures that can be very, very long and so need to be treated fairly early. She makes slow but steady progress in school, and so it's been great to watch her kind of develop new skills as she grows up.
Yeah, I appreciate that. April, Dr. Z, I want to ask you, I mean, when it comes to Dravet syndrome, and anyone who may be hearing this and may think this may be something that their child may be dealing with, talk to us about the treatment options that are available.
Yes, as I mentioned, Dravet syndrome, the epileptic seizures associated with Dravet can be very difficult to treat. Fortunately, there are 3 approved drugs on the market to treat Dravet syndrome. Today, I'm going to be focusing on Fintepla, which is an oral solution approved by the FDA in 2020 for the treatment of difficult-to-control seizures associated with Dravet syndrome in patients 2 years of age and older. And I partnered with Zogenix, the pharmaceutical company that developed this drug, so I participated in the clinical studies. One of those studies showed that on higher dose of Fintepla, 0.7 milligrams per kilogram per day, in addition to the other anti-seizure medications that these patients were on, it reduced their monthly seizures by up to 79% in comparison to 16% in patients who were taking their anti-seizure medicines in a placebo. And notably, these patients had a high seizure burden. They had an average of 41 seizures a month. So an 80% reduction, close to an 80% reduction is significant. In addition, 50% or half of these patients had seizure-free intervals of at least 21 days compared to 8 days in patients taking placebo. That's really a game changer. It really significantly has a positive impact on the patient and the family.
Yeah, I appreciate that. April, I want to ask you because, I mean, your daughter has been taking Fintepla. How has your experience been, and how has it impacted Julie?
Absolutely. It really has been a game changer for us. Prior to Fintepla, she was on several anti-seizure meds and still having long seizures, maybe 2 to 3 times a week. So those are all days she would lose from school, days our family would lose from being able to really do anything because she would just be knocked out from all the drugs we'd have to give her to get the seizures to stop. So, now that she's on Fintepla, she has significantly fewer seizures and they're shorter. So they are less impactful to her day. Her seizures are less impactful to her day and thus ours. So, she's able to go to school 5 days a week. She's able to, there's a lot of things she's able to do because she has fewer seizures and they are shorter. And it really has allowed her to improve her quality of life and ours, really.
Yeah. Dr. Z, is there any special consideration that could be taken when it comes to prescribing Fintepla for children?
Well, when I counsel families with a child with Dravet syndrome, prior to starting Fintepla, I do explain that there is a potential increased risk of problems with the valves in the heart and high blood pressure in the arteries of the lungs associated with fenfluramine, which is the active ingredient in Fintepla. So the FDA requires a risk and evaluation mitigation strategy program called REMS. And the pharmaceutical company, Zogenix, is very active in helping patients get enrolled in that program. It requires an ultrasound of the heart and echocardiogram before starting treatment, every 6 months during treatment, and 3 to 6 months after the patient's last dose of Fintepla if treatment is discontinued. What I would like to mention, though, as reassurance is none of the 341 patients who took Fintepla in these clinical studies, some of whom have been treated up to 3 years, developed problems with the heart or high blood pressure in the arteries. But that is a potential side effect I do address. The more common side effects can be decreased appetite and sleepiness.
Sorry, would you get the website out again, please?
Sure. It's called Fintepla.com.
Okay. Again, everyone, Dr. Mary Z as well as April Fontaine have been our guests as we are recognizing November as National Epilepsy Awareness Month, talking with us about Dravet syndrome, but also about the treatment option here, Fintepla, that we've been discussing here. That website, Fintepla.com, we'll be linking that up for our online audience. Dr. Z, April, thank you so much for the time and for sharing the story. Really appreciate it, and looking forward to having you back on the show again.
Thank you.
Thank you. And we thank your audience for tuning in to another great segment of Conversations Live, part of our news you can use here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.